Good morning. I promised you a series on healthcare. So we're going to start with the elephant in the room, the Affordable Care Act. Now, most of you who know me know that I was all on board for the Affordable Care Act as it was presented on paper. Everything looks better on paper than it is in real life. On paper, it sounded good. We're going to reel in those insurance companies. They're no longer going to discriminate against you for any reason whatsoever. They're going to start paying your medical bills instead of just taking your money and giving you nothing in return. If you get sick, the insurance is going to pay. Yeah, that sounded awesome, man. Didn't exactly work out that way. Didn't work out that way. So we're going to reel in the insurance companies. We're going to make them pay for sick people. They're no longer allowed to ask you if you've had a sinus infection in the last 10 years. They're not allowed to ask you how much you weigh. They're not allowed to ask you if you've had cancer or you have cancer. They're not allowed to do that anymore. They're not allowed to ask you anything. Well, except how old you are, if you use tobacco, and how much money you make. Oh, they can ask you that. See, this is the problem. We traded one form of discrimination in for another. So basically, the health insurance companies were like, oh, they're going to reel us in? Yeah, right. They're going to make us pay for sick people? Fuck that shit. We're going to find a way to still make more money than we pay out. And we'll do it instead of by not accepting sick people that we have to pay millions of dollars out for their health care. We'll just overcharge the healthy people who actually work hard and make good income. That's the way it works now. You get penalized by insurance companies because you have a good job. You can't be penalized because you're sick and you go to the doctor a lot and you actually use the health insurance. You get penalized if you never have used your health insurance, if you are healthy as all get out, and you have a good job. That's how they're getting around the Affordable Care Act. No, they can't ask us if we've ever had a sinus infection like they used to. They can't ask us what we weigh. They can't ask us if we have high cholesterol or high blood pressure or diabetes or breast cancer. But God help you, they can ask how old you are. Over 50. Cha-ching. You use tobacco? Cha-ching, cha-ching. You make over $60,000 a year? Cha-ching, 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 cha-ching. I learned this the hard way. I learned it the hard way. Because we were self-employed during the Affordable Care Act when it first came out. I learned it the hard way. I smoke. And I was 50 years old. Or 48, whatever. I was getting at that age where they start saying, oh my God, 50, she's on death's door. Something's going to happen to her. She's going to need health insurance. We better overcharge her. And of course I smoke. Oh, God forbid. Even though I have never filed a health insurance claim for any ill visit in 40 years, I smoke. She's on death's door. Something going to happen. We're going to pay out. Let's overcharge her. Cha-ching, cha-ching, cha-ching. They have a gross income of this amount. Gross income. Don't you love it when the government tells you what you can afford to pay for something? Don't you love it? They have no idea what your expenses are. They have no idea what you pay for a mortgage, or maybe that you're saving for retirement because you've been so healthy all this time. You might actually make it to 65. I don't know. They don't ask that. They just say, oh, the Lucianos make this much money. They can afford to pay more for the same plan we're going to sell to the cancer-ridden patient down the block for half the price. Now look, I never, ever, and I'm not saying it now, I never thought it was appropriate to say that someone who has a condition, an illness, a chronic illness, should be denied health insurance. But I gotta say, guys, this wasn't the answer either. My husband and I should not be penalized. Nobody should be penalized for not being sick. Okay, we should not be penalized for that. And yet that's what the Affordable Care Act did. It penalized those of us who had no children and were not ill and actually had good jobs. And it forced us to start paying for people who were sick, had children, and when I found out that someone I knew had the exact same health care plan my husband and I were getting, and they had half the deductible, half the premiums, and they had 3 children, that pissed me off. It pissed me off, because you know when you have kids, they're going to go to the doctor. You're going to use your insurance. I don't know anyone who has kids who doesn't go to a doctor at some point for something. Well, first of all, they have to go for their annual checkups. They have to. An adult, you don't have to do that. But I'm just saying, that doesn't make any sense to me either. It's kind of like you drive the turnpike and you drive the turnpike to go to work, and you are paying more money when you only use the turnpike once or twice a week. You're paying more money than the person who makes less money than you. They get a discount on the turnpike and they use it every day. That doesn't sound right, does it? My friend Sherry with the jeans. You know, I don't go to a store and get to pay $75 for jeans, and the person next to me who makes less money than me pays $20 for the jeans. The jeans are $75. You pay for it or you don't. So I don't think it's fair to make health care income-based. That does not mean I'm saying that poor people who make less money than me should pay more. What I'm saying is my husband and I should pay less. We should pay what they're paying. I mean, if we're not going to charge people for usage, which is the way it used to be. If you used your insurance, if you were sick, you paid more money. Part of me thinks that's actually fair, more fair. If you're going to be going to the ER every 10 minutes, or you have scheduled doctor appointments 3 or 4 times a week, shouldn't you pay more for health care than someone like me who never goes to a doctor, who has never been to an emergency room? Knock on wood. Never in my whole life have I been to an emergency room for myself. Shouldn't you pay more? I mean, think about it. We pay for our electric by how much we use. If I use less electric than you, I have a lower electric bill. If you use more electric, you have a higher electric bill. Isn't that kind of the way health insurance should work? And this whole Affordable Care Act, well, it gave us all this shit. They were saying, oh, you're getting all this free shit now because of the Affordable Care Act. Free annual exams. Women, you're going to get free mammograms and free pap smears. Are they really free? And who is getting them? Who is really getting them? I want to give you an example. If, say, 3 years ago, you went to the doctor and you had an annual physical and they said, oh, you know, cholesterol's a little high, you maybe need to lose some weight, and you're pre-diabetic. So that's 3 years ago. So you lose some weight, you get your A1C down, you're not pre-diabetic anymore, everything's normal. You go back to that doctor 3 years later. You say, I want my annual exam. And this is all insurance companies. You don't have to be on the Affordable Care Act, the the market. You don't have to be on that. All insurance companies have to pay for one annual exam for any adult every year. However, doctors are messing with that. Because you go to the doctor, you haven't been there for 3 years, the last time you were there, you had some issues, you took care of those issues, you went back 3 months later, the blood work was good. This doctor says, oh, look who's coming in. The person who 3 years ago was pre-diabetic and needed to lose weight. I will just automatically code this annual exam as a general illness visit. And that, my friends, means that as a patient, it's not your annual Affordable Care Act guaranteed exam anymore. It's your doctor overbilling and saying now you're going to have to pay your deductible or you're going to have to pay a copay for this visit. I don't think that's fair. And I can prove it's not fair because in 2006, I had a bad pap smear. I proved it was a lab error. The Affordable Care Act gets passed. I go for a pap smear. I don't pay for it. I don't get charged because I had a bad pap smear at one point. My question is, so the second that a doctor sees something is wrong, does it automatically turn into an ill visit even though it is your one guaranteed annual physical for the year? How is that supposed to encourage somebody to go get their checkup? I see these commercials. Go. No, it can save your life. Go to your annual physical. Talk to your doctor. Well, see, that's a problem because the doctors are timing you out. If you start talking too much, they're going to overbill the insurance company. They're going to say, well, oh my God, you're here, you're talking about, the Affordable Care Act in its entirety never tells a doctor the Affordable Care Act only covers 10 minutes. There's no time. What bothers me about the Affordable Care Act, especially with all these new drugs coming out, there's a drug now for postpartum depression. It's $20,000 drug. They want insurance to cover that. Do you know what insurance doesn't cover? A diabetes blood test once a year. If you are a healthy person, and let's face it, most people who go in for their annual exam feel great. They're healthy. They're just going in for their annual exam to make sure everything's okay. That's why you get the blood work. However, the Affordable Care Act says you can only get a diabetes test if you've previously had some kind of issues, like being overweight or having high blood pressure. Do you know how many diabetics are out there right now who look like me? They're not fat. They don't have family history. Their parents weren't diabetic, but they have diabetes and they don't even know it because the Affordable Care Act doesn't force insurance companies. Insurance companies don't cover the hemoglobin A1C blood test. Got to pay for it out of pocket, and it ain't cheap. Now, we want insurance to cover a postpartum depression drug when not everybody gets postpartum depression. And yet there are 800,000 people right now living with diabetes and probably many more who don't know they're diabetic because insurance won't cover the test. I know I'm not paying out of pocket for a diabetes test. If I go to the doctor for a physical, I'm saying I want the Affordable Care Act physical, the one that costs me nothing. Because I'm paying a premium and I have a deductible, but you know what the real Affordable Care Act physical is? It doesn't tell you if you're sick. It doesn't encourage you to talk to your doctor. The Affordable Care Act physical is basically 10 minutes, blood pressure, listen to the chest, look in your ears, look up your nose. Okay, you're good. Anything you want to talk about? You know that's going to cost extra. That's wrong. And it's not all doctors. I'm not throwing all doctors under the bus on this. Here's what I want to say about this. About, when I went through menopause, maybe 5 years ago, I went to the OBGYN. This was after the Affordable Care Act. I had health insurance. I did not have health insurance through the market. We had bought our own insurance. And during the exam, the doctor said, "Oh, wow, you have a yeast infection." I didn't know I had a yeast infection. That's not why I went to the doctor. I went for my annual pap smear and pelvic exam. So he did a swab. Yep, here's a prescription. Go fill it. It's one pill. I was fine. 2 weeks later, I get a bill for $300. An explanation. I'm like, excuse me. I call my insurance company. I say, you know what? That was my annual pap smear. That's covered under the Affordable Care Act. You have to cover that. Oh, but see, you had an infection. You had a yeast infection. Yeah, but that's not why I went. Now, within 5 minutes, I called the doctor's office. The billing was in the doctor's office. That it's rare anymore. They transferred me to the billing person. I said, this was not coded properly. And she's like, my gosh, I'm so sorry. We'll recode it. They recoded it. Guess what? I paid nothing. But here's my issue with the Affordable Care Act right now and the way doctors are abusing it. And insurance companies are abusing it. There's blame to go around. Don't you go for your annual exam to find out if you're healthy, or is the Affordable Care Act annual exam only for people who are going to pass with flying colors? Oh, you're healthy. Good. Nothing wrong. See ya. See you next year. And 2 weeks later, you're in the ER because you're having a heart attack because you didn't get a good exam. It's going to be one of the topics of my show. Overbilled and underdiagnosed. That's a show for in the future, probably next week sometime. But that's my problem. Are we going to the doctor just because we're not getting charged for it and then getting what we're paying for, which is we're paying nothing, so we're getting nothing? Are you really not allowed to sit and tell your doctor, I've been a little depressed lately, or I have a little mole here that I'd like you to look at? All of a sudden, it turns into an ill visit? Isn't that what your annual exam is for? And you want to talk about unfairness about health insurance. You work for a company, and they always offer you, if you're single, you pay one premium. If you have a family, you pay another. Here's the problem with family health insurance. A viewer made this clear to me, and I remember it from when I was working. This has always been the case. You may have one child, and your employer will say, well, that's family insurance. $300 out of your paycheck a month. Your coworker has 5 children. They're paying the same premium as you are with one child. Do you think that's fair? I don't think that's fair. I think someone who has 5 kids should pay more in premiums for health insurance than someone who has one child. And I certainly think that a healthy couple like myself and my husband with no children should certainly be paying less in insurance premiums, whether we smoke, we're fat, we're riddled with cancer. We should pay less than someone with 4 or 5 kids. I just think that's fair. We shouldn't be paying for something that we're never going to use. On my health insurance plan, we have maternity leave. I don't need maternity leave. God, I wish we would go back to the days when my husband and I could buy a la carte health insurance. When we first got self-employed, we were able to say, we're never going to need maternity care. We don't want to pay for it, and we didn't have to pay for it. Those were the good old days. So yeah, I learned the hard way. The Affordable Care Act sucks. And again, they lied to us. They told us everybody was going to be paying in, so everybody would get cheaper rates. No, it didn't work out that way. It worked out the way it always does. Healthy, working people pay more, and sick people with tons of kids pay less. And we pay more, so the people with tons of kids can pay less. That's socialism, people. So if you don't want socialism in this country, that is socialism. And yet so many people don't mess with the Affordable Care Act. We're going to lose our insurance. You know what? Figure it out yourselves. You're the ones who had 4 kids. I'm the one who worked my ass off and paid out of pocket, by the way, for 30 years to have no children. So I wouldn't be in that position. I should be rewarded for that. Instead, we get punished for it. I should be rewarded for being healthy, not punished. And when I go to the doctor, I should be able to get a complete physical at no cost. I should be able to tell my doctor things that are bothering me, things that concern me. You know, I have a mole here. Do you think that needs further review? Are we now saying that the second you are diagnosed with something during your annual exam, which is kind of the purpose, I mean, who goes to the doctor just to get poked and prodded and be told, hey, you're great, off you go? We go to make sure we're okay. But they don't care if we're okay. It's just something the insurance company has to do, and the doctors are like, shit, we make no money off of this. So we do as little as possible and get them in and out, and then we get our bonuses for seeing a lot of patients that day. That's how it works. I don't think that's fair. It's not fair to the patients. Because at the end of the day, whether the annual physical is at no cost to you, you're still paying your premiums. You're paying for a service you're not getting, and you know how that pisses political Paula off. What good is an annual exam if it doesn't actually annually exam you? My God, I've told you before, I can go do my blood pressure down at the local pharmacy. Just go in, put on the cuff, I can take that. I can find a diabetic somewhere and let me test my own blood sugar. Good, I'm not diabetic. I can weigh myself. I can figure all that shit out by myself. I know if my ears hurt. I know if my throat hurts. I don't need a doctor to do all that. Why waste my time with an annual exam if it's not going to examine me? That's the point, isn't it? You go to your doctor to see if anything's wrong. But if they're not looking, or if all of a sudden, because, you're now diabetic, does that mean you never again get an annual exam under the Affordable Care Act just because you're diagnosed with something? Isn't that what the Affordable Care Act was supposed to do? Not punish you for a pre-existing condition? That sounds like a pre-existing condition penalty to me. When your own doctor is coding your annual exam as an ill visit simply because last year he diagnosed you with an illness. So does anyone with IBS or Crohn's or any kind of a chronic illness, diabetes, they never get an annual exam covered under the Affordable Care Act for the rest of their lives? That's kind of sounding anti-Affordable Care Act. That sounds like punishing someone for having an illness. My friends, we are supposed to get one bite at the apple every year. I have always, since the Affordable Care Act passed, I've gotten my annual pap smear, and I've gotten my mammogram, and I have paid nothing out of my pocket. But when it comes to an annual physical, where blood work is taken, that's when they start to nickel and dime you. Well, the cholesterol test is covered, the diabetes test is not. I have spoken to hundreds of diabetics. Many of them, when they were diagnosed, had no symptoms whatsoever, and they were not at risk. Just like these women who have mammograms. They say, have your mammogram, because it's not just family history. I had no family history. I've got stage 2 breast cancer. Thank God for the mammogram. You're not just supposed to get the blood work done if you have a family history or are fat or have high blood pressure. You're supposed to get it done because some people have no symptoms of the diseases that are harming them, that could kill them if it goes undiagnosed. So what is this where we're picking and choosing? Well, we want to make sure we diagnose people with the high cholesterol, so that blood test is covered. The diabetics, oh fuck, they can just go into a coma and die. We don't care if they're diagnosed or not. I don't get that. I really don't. So I'd like to hear your stories as always. I have a lot of stories to tell you during this series that will probably curl your hair if you have straight hair and straighten your hair if you have curly hair. Some of the stories I'm going to tell you from my own personal experience this past year, if you have fake teeth, you're going to drop your teeth. I mean, I have been through some really wacky shit. So it's going to be a fun ride for the end of our 3rd season at Political Paula. Please stay tuned. For now, Political Paula out.